General of the World Health Organization, Dr. Tedros Ghebreyesus, has called on world leaders to fight COVID-19 in the same way that HIV and AIDS pandemic was fought. In a recorded message, he also reminds people that whilst there are efforts to find a vaccine for the coronavirus, it will take time before results are known.
20 years ago, an 11-year-old boy called Nkosi Johnson stood up at Kings Park Stadium at the Durban AIDS conference and spoke from his heart about being HIV positive from birth. Facing huge stigma at the time, Nkosi spoke for a generation of people living with HIV when he said, "Care for us and accept us. We're all human beings. We're normal. We have hands. We have feet. We can talk. We can walk. We have needs just like everyone else. Don't be afraid of us. We're all the same." That's what he said. 20 years on from the Durban AIDS conference, we can say that Nkosi's intervention and the conference overall was a game-changing moment in the fight against HIV. I'm heartened that leaders, policymakers, scientists, activists, and civil society are assembling virtually this week to discuss both AIDS and the COVID-19 pandemic. WHO is deeply concerned about the impact of COVID-19 on the global response to HIV. A new WHO survey showed access to HIV medicines has been significantly curtailed as a result of the pandemic, which has interrupted land and air transport supply chains. As a result, 73 countries have reported that they are at risk of stockouts of antiretroviral medicines, ARVs. And 24 of those countries reported having either a critically low stock of ARVs or disruptions in the supply of life-saving medicines. To mitigate the impact of the pandemic on treatment access, WHO recommends all countries prescribe ARVs for longer periods of time, up to 6 months, while supply chains for all medicines are fully functioning. So far, 129 countries have adopted this policy. Similarly, shortages of condoms and pre-exposure prophylaxis can prove costly, and WHO calls for countries to ensure uninterrupted prevention, testing, and treatment services for HIV.
As the country continues to come